Welcome to the Healthy Male webinar, Body Health and Mental Health, How One Affects the Other. I'm Vanessa Jones from Healthy Male and your host this evening. It is Men's Health Week, and tonight we're talking about how physical health conditions affect mental health and vice versa. We're so grateful to be joined by a tremendous panel bringing a wealth of professional expertise and lived experience to the discussion. Our thanks and a very warm welcome to health psychologist, registered nurse and Dean of the Faculty of Health at the University of Technology, Sydney, Professor Suzanne Chambers.
Hello, great to be here tonight.
Comedian Michael Shafar.
Hi everyone, I'm the lived experience, certainly not the expert.
Thanks, Michael. It's great to have you here. We have Tomorrow Man Principal Facilitator, Tom Bell.
I'm the non-funny one, so that's good.
Thanks, Tom. We'll keep our laughs on the lowdown for you. Health coach, Xavier.
Great to be here, and I'm looking forward to hearing all of what everyone's got to say. It's such a diverse bunch and really some amazing knowledge.
Indeed, there is. And I have on the line CEO Sam Fredericks.
Hi, everyone.
Welcome to you all. I'm really looking forward to the discussion that we're going to have tonight. Now, for all of our participants and viewers out there, a little bit of housekeeping for you. If you're watching this from Zoom, you can ask questions by clicking on the Q&A button in the bottom menu bar. Don't use chat, it won't work. Head to the Q&A. If you're watching this from Facebook or Facebook Live or YouTube, leave your question as a comment. We'll aim to get through as many of the questions tonight as we possibly can. Now, we do have a few more participants joining us now. So for those who have just joined, we're here with Professor Suzanne Chambers, health psychologist, comedian Michael Shafar, Tom Bell from Tomorrow Man, health coach Xavier, and on the line CEO Sam Fredericks. We'll be answering audience questions. So if you think of a question, send it through. If you're on Zoom, via the Q&A button. If you're on YouTube or Facebook Live, ask a question by leaving a comment and we'll respond as soon as we can. We're here tonight to talk about the link between our body and our mental health. Let's get started by chatting with Suzanne, our health psychologist. Suzanne, in your experience as a health psychologist and your work in men's health, what are some of the physical health conditions you've noticed that impact men where you've seen the greatest links between physical health and mental health?
Well, any physical illness is going to influence a person's mental well-being. That just makes sense if you think about it. A physical illness is a threat to your future, potentially. It's a threat to your sense of self, who you think you are and how you feel about yourself, and it can be a threat to your relationships. So no surprise then that illnesses that are more serious or that potentially are more chronic and go on for a long time are more stressful. And so what you see is that we have lots of evidence, lots of research evidence, as well as our experience, that if men are experiencing serious problems like cancer or heart disease, diabetes that can, is very chronic, or things like arthritis that influence mobility. All these things are associated with elevated levels of distress to varying degrees, and this can be quite long-term.
And so I think when someone's diagnosed with a physical illness or a condition, particularly if it is one of those longer-term conditions or a condition that potentially evokes a stressful response, like a cancer diagnosis or something like that, there's obviously a lot of things that need to happen at a practical level. You're probably having appointments, maybe referrals to other specialists, understanding treatments and medications and all of those types of things. And they can take a lot of time and energy just to deal with the practical side of things. And sometimes that emotional toll, I guess, of managing the physical impact can be a bit left behind. Can you outline what are some of the ways or some of the flags that someone might not be aware of at the time that indicate that maybe that emotional toll or mental health might be a problem?
Well, the emotional toll is always going to be there, whether we recognise it or not. And I think what can happen is that the family or perhaps the healthcare team don't pay attention to it because they are so busy with the practical things. This just raises the importance of us taking notice of this. Certainly, people can be in shock early on and not express those feelings, but they will be there. So it's really important for everyone to be aware of that and to make space for that to come out, and to try and help people through while they're problem solving all the practical things you have to do. To also be aware that this is tough, it takes its toll, and you want to be aware of that, look out for it and manage it as things go along.
What would be some of the things that, you know, a friend, a peer, a family member could look out for that might give them an indicator that things are not going so well?
So the first thing to say is that everyone's an individual. So there's no one recipe for how someone will express distress and what that looks like with them. But if someone is becoming withdrawn, not communicating, not connecting with others, that's a bit of a sign. If someone is feeling extra angry or irritated, not their normal self, that's a sign as well. If someone's feeling hopeless or lacking in motivation. I'm not meaning to say these mean there's something drastic, dramatically wrong with someone. I think these are normal, but it's important to be aware of that, to support someone. And if these feelings and behaviours persist, then it's important to make support available to potentially intervene so that they don't become a long-term chronic mental health problem.
All right. Thank you, Suzanne. We're going to move along to having a little bit of a chat now with Michael. Hi, Michael.
Hi, guys.
Can you tell us a little bit about yourself and your health journey as the person here with a lived experience?
So I was diagnosed in October 2017 with testicular cancer. I ended up having to do 24 weeks of chemo, and I had about 5 rounds of surgery as well in total. And I've been in remission since August 2018. So my health is at the moment really, really great, and has been for a while.
Well, I'm really pleased to hear that things are going really well for you at the moment. At that time of diagnosis, can you recall what you were going through at that time and how you managed to balance the practical needs with the needs of your emotional health and mental health?
Yeah, well, it was, I'd been kind of feeling kind of unwell for a few months leading up to my diagnosis. And I didn't really know exactly what the cause of all these different symptoms were. So interestingly enough, it was somewhat of a relief to get a diagnosis, because at least I felt like, oh, okay, I feel like I know what the problem is. And it gave me a bit of certainty, at least, as to what was causing it. Of course, I had a cancer diagnosis too. So that was always going to cause a lot of distress and anxiety for me. So, but I was very fortunate that I also had a very, my partner was amazingly supportive, and my family was as well. So I had a very good network of people around me who helped me kind of deal with the emotional side of things, and who helped me when I was, at times feeling very negative and pessimistic about my future. So, I think that without them, I think I would have struggled tremendously.
That's really interesting. When you were having those periods of time when things were feeling, when you were negative and things were not feeling so great for you at that, is that something you were aware of and raised with the people around you, or is that something that others picked up around you and raised it with you, or was it a bit of both?
I think, I tried to catch myself when I was kind of having those kind of thoughts, because, I was close to dying, really. That's kind of how late stage my cancer was. So I tried to catch myself when I was kind of in those moments. But yeah, definitely there were times where it was my girlfriend or my family who had to kind of get me out of those spaces or distract me from that kind of thinking. Because at times it kind of feels like you have to kind of not think about it. So I think it was a bit of both, but I'd say probably most of the credit goes to my girlfriend and my parents.
So that sounds like what you're saying there is it's really important to surround yourself with a good support team if you possibly can, because that the value of that at that time for you. Sounds like it was really tremendous.
Yeah, I mean, for me, like a lot of people ask if I've got much advice for other people who are going through a cancer diagnosis. I don't have a lot of advice because I think each cancer diagnosis is very unique depending on this person, their circumstances, the advancement of the cancer, whatever, and the treatments available. But the one thing that was really important for me was just, having people who I could chat to and who I could, just get advice from or give me comfort when I was kind of in need of it, for sure. So, yeah, if you don't have that support network, it's really hard, and, it's definitely something that I think people need.
Thank you. Now, in that experience, what were some of the things, the practical things that you did, or the health professional supports that you used that you found really helpful?
I guess practically what I found really helpful was that I kind of kept working, and, I was doing, chemotherapy cycles, but then in between my cycles, I usually have like a week or two where I felt great. So in that week or two, I just tried to, lead a normal life as much as possible. And that was great because it kind of, at least for a couple of weeks, I kind of felt like I had a break from being a cancer patient. So, I think, I know not everyone can continue to work during their treatment, but I would say if you can, it's such a good thing to have a bit of, things that kind of give your life a bit of normalcy. Like just going to work is really helpful.
Yeah, great, thank you. Is there anything in that time that didn't work for you?
That's a good question. I mean, what was interesting was that my doctor, my oncologist said to me, like, if you want, you can chat to a psychologist if you want. And I actually kind of said no to it. I'm not sure if that was the right decision or the wrong decision for me at the time, but I guess, I said no to it because I thought I didn't want to, feel like I was mentally not coping. But I think in hindsight, I probably should have given it a try, just to, at the very least, see, if I found it useful or not. And then if I didn't, I could have just, not done it. So I guess one thing that I'm sort of a big regret, but something that I think about is, it's totally fine to accept whatever help is available, and you don't have to be proud. You can just kind of give things a shot, and if it works, great. If it doesn't, that's fine too.
Yeah, that sounds like a terrific insight that you have there. I'm going to give you a little break for the moment, Michael, and we're going to have a chat now with Tom. Now, Tom, you're with Tomorrow Man, and with Tomorrow Man, you talk about disrupting traditional male stereotypes. What does that mean, and why is that important?
Look, firstly, just Michael, thanks for your honesty, man. It's great to hear a story. I don't necessarily know whether I've ever heard someone speak around testicular cancer at your age the way you did. So cheers, appreciate it. I think for busting up the male stereotype, I think there's a few things that kind of come into play. We live in a world nowadays where it's very, very different to what it was in the 80s and 90s in Australia. Yet we still have quite an old school male stereotype that exists in this country. It's pretty stoic by nature. The idea of not wanting to see a psychologist is part of that stereotype. And often we grow up in a world where we're told as blokes to, toughen up, take it on the chin, don't necessarily talk about your feelings. And it's not necessarily serving males at the moment in this country. So all we're trying to do is just maybe change that stereotype in any way possible and provide a bit of scope like this kind of is, and change the state of man at the moment.
That sounds really fascinating. Now, you get to go out and do a lot of facilitation of programs, and one of the things that I think you do is you talk about building emotional muscle. Can you tell us what emotional muscle is, and what does one do to build emotional muscle?
Yeah, it's a bit of a ambiguous term, isn't it? Look, emotional muscle is really the capability to talk about things that are slightly outside our comfort zone. And as men, there's a lot of things that are outside our comfort zone to talk about, whether it's feelings, whether it's struggles with anxiety or depression, And we know what the rates are for, Aussie males at the moment. They're pretty high. The depression rate for men in this country is 1 in 8. The anxiety rate's 1 in 5. But again, it's not something that we talk about. And the long-term effects of those things are pretty drastic. Right now in Australia, we lose 6 men a day through suicide, and we lose eight people in total, so 2 women and 6 men. The idea of building emotional muscle really comes down to how do we equip men with the capability to talk about what's going on in their life, rather than putting a lid on it and bottling it up and not kind of expressing what's going on. How do we provide them with the toolkit and the really basic platform just to talk to their mates, have an honest conversation? Like Michael was saying, like the ability to have that conversation with your partner or that conversation with your parents, that will often exist for men. But the struggle is, how do we provide that platform for us to do it at the pub, or to do it when you're at footy training? How do we provide it then? I think one of the hard things is for blokes that the main time they talk about it is, or when they talk around things that are going on for them, is when they've had 5 or 6 beers. And it's like, well, then I'm happy to pour my heart out and let you know what's going on. But I'll wake up in the morning and there's no way I'm going to go back to talking like we did last night. So how do we provide them with the toolkit to really simply step outside their comfort zone and grow that emotional muscle? I guess when you grow real muscle as well, you go to the gym, you work out your arms, the next day they're a bit sore, but the next time you go and lift weights on those arms, they're bigger. And the same thing goes with emotional muscle. The more we can practice having some difficult conversations, the easier those conversations become the next time we have to have them.
Thanks very much, Tom. Now, we've actually got a question that has come through from one of our viewers, and I'm going to, Tom, ask you to respond to this first, but then Suzanne, if maybe you can come in and build on what Tom says, that would be really terrific. The question is, are there some physical wrong question. We've had questions are flowing through. Let me go back to the first one. If I'm living with a chronic health condition, how can I avoid emotional distress?
It's a great question. If you're living with, how do you avoid it? I don't necessarily know whether you can avoid it. And I mean, like Michael's probably got some lived experience of it. But I would say the best thing we can is to lean on our community and learn how to do that. Learn how to have the conversations at a young age, so that we know that we can do that. Like, I mean, I think about the environment that I grew up within, and I didn't necessarily have any males in my world that knew how to have difficult conversations or knew how to have any flex outside of the stereotype of being a stoic, strong male. It wasn't until I hit my kind of later teenage years that I saw men that had the ability to tap into emotion, but also had the ability to then jump straight into power. And I think that that's where we need to work, is how do we realize that we're not one thing. We need to have some flexibility. We need to be able to move and we need to be able to adapt, but we need to be able to practice that before we can get there. It's not an easy thing to do.
Thanks, Tom. Suzanne, can you add to that around this concept of avoiding emotional distress and living with those chronic health conditions, and perhaps some alternative ways of looking at that?
Sure. So one of the things that I do when I'm working with people is to start with awareness, because the distress that we feel emotionally, the feelings, are actually driven by stuff that we think. So it's judgments we make about ourselves. It's potentially lack of flexibility in the way we look at the situation. And these are thoughts that drive upsetting feelings and distress. That is in addition to, of course, the challenges of dealing with a physical illness. But mostly if you talk to people and what's keeping them up at night is the thoughts that they're beating themselves up with. So there's a couple of approaches to that. One of them is to, first of all, just learn to sit with those thoughts and recognize them for what they are and stop responding to them emotionally in the way that you are. And awareness comes first. And then the second part can be to challenge the veracity or the helpfulness of those thoughts, and then to make a decision that you're going to pivot or shift to a different way of thinking and acting in the world. So I hate it if that sounds a little bit kind of, weird psychology babble stuff, but it's actually really true. It's the thinking we have. Oh my God, I've got cancer. This is what this means. And then the chain of rumination and thoughts that go through. And if you can interrupt that in some way, or just learn to feel uncomfortable. And I think what Tom's saying is great, because to me, when I listen to Tom, I think he's talking about psychological flexibility. He's talking about being able to pivot and shift in the way we think about things, because life is tough. You know, we hit challenges all the time, but what gets us into the most trouble is when we have a rigid way of facing it. Because sometimes it's great to be stoic. You know, stoic can be the best thing in some situations, but in other situations, you can really be hampering your ability to cope.
Thanks, Suzanne. Now, Michael, do you have anything to add to that about from your lived experience of just sitting with emotional distress and managing that?
Yeah, I mean, I think that it's not possible to avoid. You'd almost have to be inhuman to not feel emotional distress about the situation. So I kind of really agree with what Suzanne was saying, which is about acknowledging that a lot of the emotions and distress we feel flow from a thought, and a lot of times that thought is true, a lot of times it's not true. But the way that I kind of approach my anxiety, because I continue to have regular checkups and tests, and obviously there's a lot of anxiety leading up to one of those. I like to just recognize that a lot of the thoughts I have about them are kind of useless. That, even whether or not the thought is true, it doesn't really assist me when I kind of approach a test. So I try to recognize the usefulness of the thought, and if I think that it's not helping me make a good decision, and I try to I just try to ignore it, or just accept that I've had it and then move on to the next thing.
Thanks for that, Michael. Now, we have got some new people who have joined into our webinar. So for those of you who have joined, we're here with Professor Suzanne Chambers, comedian Michael Shafar, Tom Bell from Tomorrow Man, health coach Xavier, and on the line CEO Sam Fredericks. We are taking your questions. So if you are on Zoom, use the Q&A button in your bottom menu bar. For those of you on YouTube or Facebook Live, ask a question by leaving a comment, and our moderators will get those through to us, and we'll get through as many questions as we can. Now, I'm going to move on now to have a chat with Isaac. Isaac, I know you've probably been chomping at the bit to join the conversation. I can sense that passion that you have for that mindfulness and the mindful movement really coming through strongly. So what is mindful movement, and what's the benefit for our physical health and our mental health?
Well, mindful movement is really moving deliberately. And there's three main aspects to it. One is being really aware of your posture. Second is your breathing. And third, your reason why you're exercising. And posture is so important at the moment because so many people stuck inside, the pressure that they're under. I see a lot of my clients who are on these calls all day, and they get a very compressed posture, and they don't realize how much stress they're under. And just to align their posture correctly and breathe in the right way has such a profound effect on them. And when I talk about what is correct posture, I like to get people to embody a posture rather than sit up straight and that rigid military style. It's more about embodying what I call the move like a dancer, move like a graceful athlete, with that grace, that composure. And for a lot of people, they ask, how do I maintain this? And it's quite simple in that, and I'll do it from the side, where it's ear to shoulder to hip to knee and just forward of your ankle. And I get my clients to every 45 minutes, an hour, they get up against the corner of a wall and just realign themselves. And at that time to be focused on their breathing. And what I focus on so much for people is to breathe in and out their nose. Because when we're talking a lot all day, we become mouth breathers. And when you mouth breathe, you're going to breathe shallow. You're more in that fight or flight mechanism. But when you breathe through your nose, it calms your breath. You've got filters, which is very important at the moment with COVID, not only just COVID, but if you get a cold or a flu, as we can see that if you're immune compromised, you can really suffer from this disease, from this virus. So what I get people to do is breathe very slowly and deeply through their nose, and to know that in our paranasal sinuses here, there's this magical gas, this molecule called nitric oxide, and it helps dilate all of our lungs, dilate our blood vessels, but also helps sterilize the air. And it's what I call the little bike messenger of the body. What it does is it helps the body, all the cells communicate with each other. So posture, breathing, so important. And when people are exercising, I get them to really focus on moving slowly and deliberately. So I see in the gyms a lot and people out running, and they look like they're in just pain. They have the pain face, they're breathing through their mouth, they're all hunched and tense. And it's like you see people running on the treadmill. You can always see the angst dripping off the treadmill. So, and that comes to the third point, which is, why are you exercising? If it's a very negative, fear-based reason, like saying, well, I'm fat and I'm fit, and my wife says that if I don't stop snoring because I'm so heavy and drink too much, she's going to kick me out of the house, and my dad died of, liver cancer, and all these negative reasons. So I've got to come in here and work out. And I bring it back to an essence of self-care to say, yes, you've got all these external reasons. Yes, you want to look better, but how do you feel? And to help you to recognize that everything in life we do because of how it makes us feel, either avoid pain or gain pleasure. So to get people to feel what's happening, and what Suzanne was talking about, what Tom was talking about, is experiencing what's going on. Often so much tension in their upper trapezius muscles here and through their chest. And I get them to move really slowly with their eyes closed, breathing in and out their nose. And as soon as an old pattern of shrugging up or tensing their face or gritting their teeth, I just gently get them to breathe through it, let it go, and just gently remind them that this is important for their own well-being. Forget about the rest of the world at that moment. So they're the three things: posture, deep, slow breathing, and knowing really why you're doing it, and that it's a reason that is caring for yourself.
And I did notice while you were describing those elements, Isaac, that I certainly was adjusting my posture and breathing, and I saw Tom doing the same. So I think that's probably just given a number of us some cues to be present here in the moment. And I know when we were chatting the other day, you were saying with all these Zoom meetings and video conferences and webinars, just even focusing on someone and looking down the camera in their eyes is a really good way of staying engaged. Now, I've got a couple more questions coming through the Q&A. So I'm actually going to throw back to Suzanne at this point. Suzanne, are there some physical conditions where you're more likely to experience anxiety?
Well, I confess that the thing I know the most about is cancer, because that's where I've done my research, and particularly in prostate cancer. And so I think there's no question any diagnosis of cancer is highly stressful. And the research that we've done has shown that in prostate cancer, certainly in the short term, 1 in 4 men report significantly clinically high distress. And 2 years down the track, even after localized treatment, it's 1 in 5. And we followed men for 10 years and found 10 years down the track, 40% of them still reporting worry and distress. So, but it's a very individual thing. I know that there's similar statistics for heart disease. And the other thing I think that's interesting to note is that when we look at what predicts men who have more distress down the track that really persists, it's the number of physical illnesses they're dealing with. So as we all age, we're more likely to you might get cancer, you might have some heart disease, you might get arthritis in your knee, you might get diabetes. It's all like cumulative stresses that add up. Other factors that increase the likelihood that you're going to be distressed is if you're young, because you don't expect to get serious illness when you're young, and so that's a really big existential threat. If you're alone and you don't have good social supports, and I flick back to what Michael was saying about how he had, you know, a supportive partner and he had family that were helping look after him, that's super important. And if you don't have a lot of financial resources, that makes it tougher as well. But it is an individual thing. We all have different ways of coping. And so it's not everyone's going to be like this. And really, it is about the individual. What's happened to you and what's the meaning of it to you? And then, and from that, how are you going to have the best life you can with the cards that you've been dealt?
Thanks, Suzanne. I appreciate that response. I'd like to actually move now to having a chat with Sam. Sam's the CEO of On the Line. Sam, could you have a chat with us about what is On the Line and what's Men's Line Australia?
So On the Line is a social health organisation, and we deliver outsourced telephone and digital counselling services. And we are an outsourcer, so we deliver them on behalf of other people. But some of the big public-facing lines that people might know about are things like Men's Line, which is one of our really our big and long-standing services. And Men's Line is a telephone and online counselling service for men, mostly men with relationship issues of some kind. And that doesn't mean that it doesn't mean that they have problems only in their intimate relationships. It's about their social health. So people's relationships with themselves, with the community that they live in, and with the people that they care about. And it's for all men and all types of relationships. So we've found that men really like to engage with Men's Line. And I guess there's a number of reasons for that as well, because we try to use solution-oriented language with men rather than talking about them suffering from mental ill health. So we'll talk about, you know, if something's, if you're struggling with something, or if you're having problems with something in particular, and just try and use like really clean language rather than complicated constructs or ideas about talking about, do you feel depressed or do you have anxiety? Because people don't want to necessarily identify with that. They just want to talk about how they're feeling in a way that's meaningful for them.
Thanks, Sam. What are some of the common reasons, if you can even tell us that men do contact Men's Line? And you've gone through a bit of the relationships are a really key thing, but what are some of the more pressing things within relationships that people are contacting Men's Line about?
So there's a range of different things. So loneliness and social isolation, especially in this time of COVID-19, the crisis that we have. Often people are lonely, but we find that across all of the services, including Men's Line, the incidence of people who say that or disclose that they're feeling lonely is about the same as the national average, so about 22% of people who speak to us. Some people have a much lower percentage do have a mental health issue. It might be a chronic mental health issue or an acute issue that they've had a major incident for whatever reason, could be physical or an emotional incident, and they're experiencing mental ill health. Might be that they're concerned about parenting. So we have a lot of interest from new dads who want to talk about what it's like to be a dad and how they can be a really good dad. There's people who are in relationship breakdowns, and are talking about family support type issues. We also support men who are both using and experiencing family and domestic violence. So it's a really wide range of different topics and reasons.
Yeah, so it sounds like it really is a place where you can go for many different things. It's not a specific thing. So Men's Line is a place that people can reach out to for anything that's going on. Now, panelists, we've got a great question that's come in, and I'm going to pose it to all of you. The question is, it sounds like the panelists are saying we should all live in the moment. What do they recommend as the easiest way to do this when you've got 6 things happening all at once?
I'll pipe in.
Thanks, Isaac.
I find the best thing to do, especially I saw this with mothers homeschooling, and they're just 24/7. They never get a break. What do they do? And I found the best thing to do is go to your physiology. If you're hunched over, if you're all tense, you're not going to be at your best. You're not going to be optimum. So I would ask them to be mindful of their posture, and also, but just focus on breathing as slowly as possible where their nose hairs hardly move. So to go their physiology first, and then notice what happens with their emotions and their thoughts, and whether they're leaping into the future or worried about the past, but just bring themselves back to their breath. I found it helped. That was one thing they could do immediately, and it did make a difference.
Thanks, Isaac. Tom.
Sorry, Susan, go after you, Susan.
I'll be quick. So you can't focus on being in the moment all the time, right? But you've got to do it some of the time. And so it can be really simple things. It can be being in a busy meeting, for example, and then just deciding you're going to take a breath, a bit like Isaac is saying, and you're just going to focus on something else in the room, which could be just noticing your environment or noticing what you're hearing, just to bring yourself back to the minute. If this kind of idea of mindfulness and being in the moment really comes out of the Buddhist tradition. And the idea of it really is, in a way, to give your brain a rest. Because if you're focusing on the moment, or focusing on that beautiful leaf over there, and isn't it interesting? Like, I know this sounds a little bit weird, right? But it really is drawing your attention away from the clamor of thoughts that go on in your mind, and drawing your attention to something in your environment and just noticing it. And that immediately brings you into the moment. And even if you just do that every now and again, you start to train yourself to see this as a thing that you can do, to just bring yourself a little bit back to present moment awareness. And it's just relaxing, because it stops you from the clamoring noise you have in your head about all the things you've got to do and you've got to juggle, and all the weights you put on yourself about what and who you think you need to be in the world. And I'll go to Tom.
Thank you. I would just say that having some really good keystone habits that you kind of live by. So, the latest research around, 20 minutes of exercise a day, and the long-term impacts of that means that you're going to eat better food, you're going to sleep better at night. As the same with meditation. Like I'm useless when it comes to meditation, terrible at it. But I used to travel probably 3 or 4 nights a week for work, and I would be go, and I would never sleep well in a hotel room. But I would find, if I was able to slow down, put one of those keystone habits of doing some exercise and then a meditation before I went to bed, I would sleep better. Throughout this time of COVID, I've been doing weird little things to kind of keep me on track. So the commute to work doesn't exist anymore, because for a lot of us, our work life now bleeds into home, and our home life now bleeds into work. So we need to find ways to kind of have a real definitive break, especially if you've got young kids, like Isaac was saying. I've got a 3-year-old at home, and I literally go into her old bedroom to work throughout the day and then come back out, and it wasn't working. So what I started doing was making my coffee in the morning, putting a podcast in, walking around the block, and that was my commute to work. And then I would go into the office. So I would have a really clear break where it's like, right, that was home, now I'm at work. So how do you find ways to put routines in that help you to be the best you can be in those moments?
Thanks, Tom. Michael, juggling lots of things all at once and trying to find that time out to be present is really tough. Have you got any tips from your personal experience of how to juggle all the clutter and all the things that are going on and just take some time for yourself?
Yeah, I mean, I wasn't going to jump in because I feel like kind of Tom kind of said something that really I would say, which is that I've started, meditating, and I find that it's really useful. Even if I'm terrible at it as well. Like, I just constantly just think about what I've got to do the rest of the day. When I'm very bad at meditating. I don't know how people do it, but I guess just trying to work that into my routine now. I try to do it twice a day. And what I find is interesting is that even if I feel like there's so much going on, there's so many things to do, it's almost like taking the time to meditate makes me realize, it's fine. Like, if I've got time to meditate and focus on my mental health and prioritize that, then, everything else, I can't be that busy if I've still got time to take care of my mental health. It's kind of maybe just a weird delusion, but I find that's really helpful, just doing that even when I'm busy, and it makes me feel like, it's fine. If I've got time for this, I've got time for everything.
Thank you. Now we do have a couple more questions coming through the Q&A. Suzanne, I'm going to throw this one to you. My doctor's spoken to me about perhaps having cognitive behavioural therapy. What's that?
Okay, so I get away with saying this because I'm a psychologist, right? We got a complicated name for everything when it's actually not really that complicated. Cognitive just means you're thinking, and behaviour just means what you do. And so I use these principles when I'm working with men and with women, and I say to them, what I was saying earlier, what are you thinking? What's going on in your head, and is it helpful to you? And is it realistic? And let's look at that and look at how that's potentially driving how you're feeling. So it's getting you to be aware of what you're thinking. I think it's helpful. And then there are different ways to deal with that. You can either try and change your thinking, or if there's an alternative way, which is just learn to sit with it, become comfortable with it, and diffuse from it so that it's not driving your emotions. The behavioural part of cognitive behavioural therapy is just changing behaviour, and really that's about men in particular tend to like a problem-solving approach. It's saying, what am I going to actually do? So I'm going to change the way I think, or become comfortable with my thinking and awareness of where I am, and I'm going to look at what I'm doing, and am I acting in my own best interests? And potentially I'm doing things that are making life tougher for me, and then I can make a choice about am I going to keep acting that way and get the same result? Or would I like to be a little bit playful and try with some different actions that might get me a different outcome? There I drive back to kind of a broader approach where I'm saying it's about being flexible, psychologically flexible, and being prepared to pivot if you need to. And I think it might have been Michael or Isaac were talking about a toolbox earlier. It's what are the tools in your toolbox to help you yourself live the best you can. And if the spanner's not working, well, perhaps you need a different tool.
Yeah. So it's one thing that people could try amongst a suite of things.
Absolutely. I mean, cognitive behavioural therapy, certainly in chronic diseases, being the most researched and evaluated. It's a good, robust way to approach things. There are self-help materials that you can get to try it out, but it can seem a little weird. So sometimes if you go to someone who's an expert in it and have a session or two, so you learn the techniques, and then you can take it away. And I always say, again, be playful with it. It's just like what it is it's a tool. May or may not work for you. Give it a go.
Thank you. Now we've got another question coming through, and this is around the diagnosis of cancer. So I get that having cancer is going to give people depression and stuff like that. When I burned out, my health went really downhill. How come? Maybe Suzanne, if you could lead that discussion, but then if others can chip in, and Michael, if you've got any insights to add, that would be terrific.
All right. Well, the first thing I would say is that, when you're feeling really down, whether it's depression or you're feeling really anxious, there are physical symptoms that go with that very often. If you're really depressed, it can affect your sleep. You get really tired. You can drink too much. It can disturb your eating. All sorts of things happen. So generally, you can start to feel worse. If you're really anxious, the physical symptoms of anxiety can be tightness in the chest, tight throat, a whole range of dry a whole range of physical symptoms that we can express anxiety through. So if you're feeling any of these, distressing emotions, there's physical feelings that can get wound up in that. And that's why I really think a holistic approach is what's needed, where we're talking about thinking about awareness, changing how you're thinking potentially, or getting comfortable with that, doing mindful movement or exercise, looking after yourself as an entirety, looking at your relationships, making sure that you've got relationships that are healthy and good for you, and really becoming your own best friend. And what I'm hearing from Tom and from Isaac is that they're doing that with people, and Michael's given us a great example of how he just worked this out himself and did all these things, and it helped him.
Yeah. Michael or Isaac, have you got anything to add to that?
I have.
Sorry. You go, Isaac.
Okay. Now I've lost my thought. You go.
Back to you, Michael.
Oh, okay, cool. All I was going to add was I think that the two main things for me in my experience that probably stopped me from spiraling into a depression or into a really hyper anxious state were having really strong relationships that were kind of really, I had always people I could speak to when I was anxious. And probably the other thing was just having a sense of purpose. So even though I was going through cancer, I was still working, and I was probably very in the fortunate position as well, which a lot of people probably wouldn't be, which is that just because I'm a comedian, I draw on life experiences in order to kind of do my job. So cancer just became for me like another life experience to draw upon in order to kind of do my job. So for me, I guess I found a purpose in it through that. I'm not sure if everyone can find a purpose through a cancer diagnosis, but for me, that was my purpose, and it really kind of gave me a bit of motivation to get out of bed every morning and keep working.
Thanks, Michael. Now, Sam, I'll get you to kickstart the next discussion, but general advice for the management of things like anxiety and depression. What's the general advice that or suggestions that you would give someone? And I might actually let Sam have a drink on that, and I'm going to pass to Isaac, and then we'll come back to Sam.
I've got all my thoughts back. The one thing when people they've got a chronic illness, often they can lose faith in their body, especially if it's letting them down. And so as much as they can regarding especially what their doctors or health professionals advise them, I'd say, and this is for everyone, but especially these people, that you make exercise a non-negotiable, that every day, even if it's to walk around the block. And I find music is one of the great motivators. So to make up a playlist that it's just one of those cannot not move to. And we all have our favorite soundtracks that make us feel better. We've all had experiences where we hear a song and it immediately lifts our spirits. So that's the first thing. And the other thing, what Michael spoke about is connection and talking to people. And this is where I love Sam's thoughts on how to encourage men to talk, because from what I've found, people have also often asked me, they said, what's the fountain of youth? And I've always said it's always about connection, but then I've found the science to back it up. Very long story short, meta-analysis of 300,000 people done over 10 years found that of the top 12 things to live a happy, healthier, more fulfilling life, being right weight and exercising, that's important. But the top two were all about social connections, having those conversations, but also the one I love, the number one, was how you actually integrate, how you communicate with each person every day in your life. And when we were speaking earlier, Vanessa, that I ask people to be really present when they're talking to someone and try to not entertain the thoughts of what am I going to say next, but where I get them to notice if their eyes are visible, notice the color of their eyes, or if they're talking on the phone, to really become present, to say nothing else exists except for this human being right now. And it's amazing, you get this state of grace that overcomes you. And with men, and what I'd like Sam's thoughts is, I know men, we're hardwired not to speak because of a lot of our physiology, testosterone and the ancestry of, we used to go to war and it wasn't smart to talk a lot or be emotional, because when you want to fight an enemy, you don't want to get emotional about it and think, oh, this is another human being. But what do you find you encourage men to do so they can feel comfortable, like what Tom does, feel comfortable to talk and flex that muscle so it grows permanently?
Sam, over to you.
Big question. I think that we are a social health organisation, so we absolutely believe in the power of connection and forming positive relationships, and that was something that I was talking about earlier. So we do encourage men who are experiencing issues that are impacting on their ability to live their normal life. So if they're feeling anxious or depressed, for example, which was what the question was before, and that's stopping them going out and interacting with people, we try and think about how can they form some sort of a connection. It doesn't have to be in a traditional way of making friends and ringing people up, although you can, of course, ring up Men's Line if you want to, but it can be, you just need to find somebody to talk to. And one of the pieces of research that we've referenced in the past has been about the idea of engaging in some sort of a social activity, whatever that might be. It could be sport or walking or something that you like doing, but not necessarily speaking face to face with people, like walking side by side with them, so that it's less confronting and you can just start a bit of a conversation, and it doesn't have to be a heavy conversation about how you're feeling. It can just be a connection and just a way of starting a spark of connection that can potentially build over time. And you can try it with your friends, with your family, with your doctor, or people that you don't know, if you want to go to some sort of a group or something that's a little bit meaningful to you.
Now, we've actually, just along those lines, had a question come through from one of our viewers. How do you bring up the topic of mental health with your doctor when the priority is to get through the physical symptoms? So for this person, they feel like they're a hypochondriac in bringing up that something else is wrong when the focus has been on the physical symptoms. Suzanne, can you lead off on that for us?
Yeah, sure. A lot of the work that I actually work really closely with medical doctors and clinicians in the cancer area, helping them with this very question, because they actually know their patients are really distressed and they're not sure what to do. And I've had them say to me, Suzanne, we know, we feel bad, we're anxious, we'll make it worse, but we'd like permission to be able to bring it up. And so what I always say to them is just bring it up and just sit with your patient and let them know that you're there and you care about them, and that's your first step. So I think what patients often do, and men and women, they all do it, when you're being treated for a serious illness, you're so grateful to the doctor. You want to be a good patient. You want to show him that you're up for it and you don't want to waste his time, and you know he's busy. When actually, I think you can bet he does care about how you're feeling, but he's not a mind reader. And if you don't tell him what's going on, he's just not going to know. So I do a lot of work with clinicians, giving them tools and trying to help them to raise it with you. But unfortunately, at this point in time, you can't rely on the fact that they're going to know how to bring it up or that they will. But I can tell you that they do care. And so bring it up with them. And if you feel uncomfortable with them, go see your GP and talk to them about how you're feeling and what supports are available. There are also helplines. I mean, you know, Sam's talked about Men's Line. If it's cancer, there are cancer helplines. There are lots of places to get support. So if you really don't think you can raise it with your clinician, there'll be someone else you can talk to about this.
Did you have anything to add to that one?
Yeah, I think that the issue here is we're talking about this in older men. And the reality is you go into a high school these days and 15, 16-year-old kids are more than happy to talk about depression and anxiety. They've got a language to talk about it. They know how to talk about it. The real issue is that there's still a stigma around talking around mental health in the older generation, in my friendship circles and above. And unfortunately, we still have a fear around it. When the reality is that if you walk out the street tomorrow and 1 in 5 guys that you look at is also going to be battling anxiety. And it's just having the ability to go, well, I'm not the only one that is suffering at the moment, or I'm not the only one that's going through this. So I think one of the things we need to look at is how do we get blokes into a room with a bunch of blokes that are going through different experiences, doesn't matter whether they're positive or negative experiences, but have them have that connection piece, which kind of Michael talked about at the very start, but have them connecting with one another and hearing each other's stories. And they don't have to be dark stories about battles or whatever it is, but they just need to be able to hear each other's experiences so that they start to understand, all right, well, I'm not the only one that, is suffering some financial stress at the moment. I'm not the only one who's freaking out about becoming a dad. I'm not the only one who was bullied at high school and is still holding on to that shit 15 years later, How do we get people in a room to share experiences so that those experiences we learn from? But I think that that's happening in the younger generation at the moment. They're sharing those experiences more and more and more. And their language is just stronger than ours is.
All right. Well, I am getting the message that we're getting very, very close to time. I've got one last question and I'm going to give it to each of you to wrap up and give your take-home message to our viewers in about 5 to 10 seconds each. And this is something that we will all resonate with, I'm sure. When trying to balance busy work-home life, working, commuting, committing to exercise, families, when do we find the time for rest? When do we find the time for mental health? What does rest involve? What's your take-home message, Suzanne?
I've got 2 things to say. The first thing is you really matter. The second thing is become your own best friend.
Thank you, Suzanne. Isaac?
What I spoke about more with feelings. So to do what makes you feel good, that it's also very constructive, not destructive things like drinking, etc., but things that really, really make you feel good.
Thank you, Isaac. Sam?
I think similar to Suzanne and Isaac, for me, it's about connection. So finding some like-minded people that you can talk to on whatever level you feel comfortable with.
Thanks, Sam. Tom?
2 things. Firstly, however you're feeling, you're not the only one feeling that. One of your friends is, one of your work colleagues is, someone else is. You're not alone in that. And number 2 is do something that's going to make you better. I'm a dad of 2 young girls, and I know that I'm a far, far, far better dad if I take half an hour out and go for a run than if I don't take that time out. So find time to do things that are going to make you a better, more present person.
Thanks, Tom. And Michael?
Yeah, I would just add that I know it's obviously really hard, but really prioritising your health, both physically and mentally, is really important. It's something that I didn't do for a long time. I didn't think it was something that would affect me as a young man, but it certainly did. And it's completely changed my perspective. And I think it's made me a much better person, a happier person by prioritising my mental health and physical health. Even though it's really hard, it should be everyone's number 1 priority.
Thank you, Michael. So we're coming to the end of our webinar. If you do need some mental health support and you're not sure where to start, do head to Men's Line Australia, 1300 78 99 78, or visit them online. And also, if you're really feeling distressed and don't know where to turn, there is Lifeline, 13 11 14. Both services are available 24/7 by phone and online and are ready to chat anywhere, anytime. That's a wrap on our 4th activity this Men's Health Week. Thank you to everyone who's joined with us tonight to learn more about how our body health affects our mental health and vice versa. A very warm thank you to our panellists tonight who have shared their expertise and experience. We really appreciate it. Have a great night, everyone, and thank you all for your support.
Thanks.
Thanks, guys.